Hello, my name is Chenelle Martin, and I'm doing a video validation for the central venous line dressing change. So I've reviewed the physician's orders, I have gathered my equipment, I've washed my hands, and I'm ready to enter the patient's room. So I enter the patient's room, making sure to provide privacy for the patient, and I want to introduce myself to the patient and also check that it's the proper patient by checking the ID band and having them state their name. So I explain today's procedure, and I raise the bed to a comfortable working height. And I also raise the head of the bed to a comfortable low Fowler's position. So I pull down the patient's gown and just assess the wound site for any redness, any drainage around the wound site, and ask the patient if they're experiencing any discomfort and assess their pain level. So there's no drainage, so we can now proceed. So I wash my hands and I don my gloves, my clean gloves. I want to open up my packaging. Grab just the corners from the 1-inch border around it, place it on the table, and place the packaging on the side and use it as a receptacle.
I don't know where to start. Like, I know how to do it, but I don't know, like, I'll get myself working. I did.
So I want to just remove my sterile gloves and my mask. And I want to ask the patient to turn their head and not touch the wound site or any of the supplies. So now I'm going to carefully remove the wound bandage by holding the center down. So look at the corner. So I'm going to remove my gloves and discard them. wash my hands. Okay, and then I'm gonna grab the corner. I'm gonna grab my sterile gloves and open them. So I make sure only to touch the cuff. And I grab the other glove.
First, should we done this glass? Open first, and then the glass.
Okay, after having my gloves on, I want to come over to the sterile field and grab the wound bandage and the core prep. So I'm going to break the seal on the core prep and vertically. I want to clean it very vigorously in a vertical manner, and then for 30 seconds. I also want to clean horizontally for 30 seconds. And I want to lift up the lumens with one hand, making the hand now unsterile. And I want to clean underneath the lumens. Okay, so I'm going to hand over and drop into the receptacle. Then with my sterile hand, I'll pick up the bandage and peel throw it in the proper receptacle. And I also want to wait till the ChlorPrep solution dries on the person's skin. And also, I want to put a bio patch, protective patch on the patient to protect the lumens. So after the patient's skin has dried, I want to put the bandage over the dressing, over the wound, and I want to make sure that it is clear in the window, and I want to only put it down with my sterile hand. And I'm going to manipulate the lumens through the bandage here. Kind of pat it down so it sticks. Then I want to remove the paper. And I want to discard in the proper receptacle. Okay, I want to cover the patient and raise the side rail. Lower the patient to the lowest position and make sure that the pole belt is within reach for the patient. I want to assess the patient's comfort level, make sure they're comfortable. Turn and adjust the patient's head. Want to remove my gloves and discard the proper receptacle. I want to wash my hands, remove my mask. I want to discard my materials. I also want to write down the date, time, and my initials on the paper and just stick it on the top surface of the patient's dressing. So the next person knows when it was changed last. So I want to continue throwing away my materials. And I want to make sure to throw it away in a proper receptacle. And wash my hands. Then document all my findings in the nursing notes. And that concludes my video.